Welcome everybody to the New Hampshire State Plan on Aging public comment session. My name is Joe Moncher. I am the state facilitator of the New Hampshire State Plan on Aging Planning Committee, and I'm absolutely honored to welcome all of you to today's event. So today is a public comment session, and we look forward to securing feedback from everybody regarding the New Hampshire State Plan on Aging. I sure want to thank Christy St. Laurent from the New Hampshire Legislative State Committee on Aging for providing lunch sandwiches for us today. And I sure want to thank this building and the town of Derry for hosting us. And I also want to thank our friends at our local cable station for airing this publicly so others can hear this important message. So next slide, please. So our goal today, over the next hour and a half, is to provide a few welcome comments, to provide an overview and some highlights on the process of the State Plan on Aging and how we got here. We're going to talk a little bit about a 10-month planning process and the significant work that has gone into this. And we're going to talk about some partnerships and the opportunity and the challenges of bringing partners together to create the next 4-year State Plan on Aging to better serve and support older adults across our state. So then we're going to go into public comment sessions, and I sure welcome and appreciate everybody's thoughts on the State Plan on Aging and your thoughts as we move forward on this important work. So next slide, please. So it now gives me great pleasure to introduce one of our leaders in the community and in the state regarding older adults. New Hampshire State Representative Phyllis Katsoukaris has actually been with us throughout this process. She joined us at the Marion Garish Community Center for the listening session, and she's a significant advocate and champion and ambassador for older adults and the aging community. Thank you, Representative, for joining us today.
It's my pleasure, and I welcome you to Derry, and I want the people in Derry to know about this very important program, the State Plan on Aging. We're all getting there someday, so we better understand what it's about, and I do welcome you all, and I'm quite interested in the presentation, and thank you for coming to Derry. It's our pleasure to host this. Thank you very much.
Next slide, please. So my name is Joe Moncher, and again, I'm the state facilitator of the New Hampshire State Plan on Aging. Honored to welcome all of you to today's meeting. Next slide, please. So last fall, the Bureau of Elderly and Adult Services at the New Hampshire Department of Health and Human Services, we started planning our efforts to create and develop the next 4-year New Hampshire State Plan on Aging. And the first thing we did is we reached out to our community partners, our service providers, our community organizations, and said, we'd like to invite you to join our efforts as we create the next 4-year State Plan on Aging. And the slide you see behind me is a listing of our community partners from across the state who have come together to help us put together this state plan. As you see, this list is pretty significant. It's a tremendous group that represents statewide outreach and partnerships. This group has been meeting every month for 2 hours. There's literally been hundreds and hundreds of hours of conversations, emails, and discussions regarding what we want the next 4-year State Plan on Aging to look like. I cannot thank the groups on this slide enough for their significant leadership and contribution. Next slide, please. So the goal of the New Hampshire State Plan on Aging Planning Committee is to develop a 4-year state plan that helps to guide our state's efforts in understanding, serving, supporting, and celebrating older adults across the state. This is a pretty significant mission statement. And if you look at the word state, it has a small s. And I want to just bring your attention to that. So when we first started talking about this goal, it was the word state had a capital S, representing state government. And our community partner said, oh no, This is a small s, because the work of the State Plan on Aging and the work of serving, supporting, and celebrating older adults, that's a responsibility and an opportunity that belongs to all of us. So we changed the mission statement to reflect that, and our work really reflects that as well. Next slide, please. So there's a lot of cooks in the kitchen as we work on this, and we want to make sure everybody's working in the same direction. We're working on the same path. And so I want to clarify some of the roles of the players and the partners on this work. The plan is being developed by the New Hampshire Department of Health and Human Services, Bureau of Elderly and Adult Services. So at the end of the day, somebody has to own this. If the governor has questions, if our executive council members have questions, someone has to be able to respond to that. And per Older Americans Act, per federal legislation, the entity that owns this is the New Hampshire Department of Health and Human Services, Bureau of Elderly and Adult Services. We're working with an awful lot of guidance from the New Hampshire State Plan on Aging Planning Committee. The signatures that go next to this plan when all is said and done is the Commissioner of the Department of Health and Human Services and the Chair of the State Plan on Aging Planning Committee. We have with us today Ken Berlin. Ken, if you could just raise your hand. So Ken is the chair of the New Hampshire Legislative State Committee on Aging, and he has been instrumental in helping to serve and support this work as we move forward. So thank you so much, Ken. So the plan is approved by the Federal Administration for Community Living. This plan is due to our federal partners on July 1. We have sent them several drafts in advance to make sure we are all on the same path as we move forward. So when you look at this slide of the different partners, this is pretty significant because we are going to be more powerful in this state if we work on this plan with one voice. And so it's really important that we put together the feedback from our older adults. So if you look at the bottom of this slide, that's the most important part, and it starts with you. It starts with older adults in our community. It starts with the aging community across our state. So we want to make sure we put the feedback together from older adults. We want to put that together with our state resources and our state capacity. We want to partner with our planning committee members from across the state, and we need federal approval. And we need to follow the focus areas of our federal partners. So this represents a lot of partners, a significant opportunity, and a responsibility that we sure take very seriously. Next slide, please. So we are guided by the Older Americans Act. It's a piece of federal legislation that's been in place for over 50 years. So we have 50 years of guidance as we tackle our next 4-year state plan on aging, which represents over $20 million annually in all kinds of services to older adults and adults with disabilities across the state. So when I invite you and I encourage you to look at the state plan that's in front of you. Also, you can find this state plan on aging on the website of the Bureau of Elderly and Adult Services at the Department of Health and Human Services. You're actually going to find about 120 pages packed with all kinds of content. You'll be able to find a narrative, a piece on demographics, a piece on service delivery, an organizational chart. You're going to find pages of a survey analysis, about 50 pages from a survey analysis from older adults across the state. You're going to have tools and resources in the last page. So again, this document is packed with information. This week represents our 30-day countdown, right? On the 29th of this month, feedback closes. So today is May 1st. We have 29 days to provide final feedback in the development of the state plan on aging. I invite everybody to go on the BAS website or to go to your local service link office if you don't have access to computers. Ask for the state plan on aging. Review it. Send in your feedback. If you can't send it electronically, mail it. We welcome everybody's feedback. Countdown starts this week. Next slide, please. So we're right at the end of our 10-month planning process. It's included a lot of different pieces. It's been a very fast-paced process with robust feedback from across the state, especially our local communities. So I invite you to to check out this 10-month planning process. You're also going to find this PowerPoint presentation that I'm sharing with you today. You'll also be able to find that on the website of the Bureau of Elderly and Adult Services. Next slide, please. So as we started planning and securing feedback on the development of the state plan, we coordinated 15 listening sessions across the state. These listening sessions took place at senior centers, at community centers, hospitals, nursing homes, libraries. We hosted them at several different locations because we wanted to provide opportunities for older adults to come and participate in this process at different locations based on where they might spend time, based on areas they were familiar with. So I sure want to thank and recognize the Derry community. We held the listening session at the Marion Garish Community Center, and that was a wonderful gathering. And I sure want to thank State Representative Phyllis Katsoukaris for being a part of that as well. So again, she's been with us through this process, and we're honored to have legislative leadership and representation from our state. Next slide, please. So in addition to our listening sessions, we also conducted a survey outreach campaign. So our 30-plus committee of community providers, of state leaders, of older adult representatives, we put together a 29-question survey. Hundreds and hundreds of hours of putting together that survey. And we were actually honored, thrilled, overwhelmed by the response. 2,927 individuals from across the state representing the aging community responded to that survey, and it's packed with all kinds of information. Again, you can find all of the raw data from that survey on the website of the Bureau of Elderly and Adult Services. And I encourage everyone to check out that information, to use our state planning data to help your own local efforts as we move forward on this important work ahead of us. Next slide, please. So we also reached out to the organizations on this slide: the Center on Aging and Community Living, the New Hampshire Department of Transportation, the Southern New Hampshire Planning Commission, and the University of New Hampshire at the Institute on Disability. And these are the entities that really came forward to support our efforts in analyzing the data. So again, these groups collected the data, summarized it, prioritized it, analyzed it, and again, you're going to see those results on the website of BEAS. And the state plan that you have in front of you, that work was really guided by the feedback from individuals from the aging community. And I want to thank Martha here. So Martha is here, and it's her birthday. She's 84 years old. And she actually took surveys and brought them and shared them throughout the greater Derry community. And that's what it takes, right? So we have a small gathering with us today, but it's the power of one person. The power of one person to create change across this state and helping others. So happy birthday, Martha, and thanks for your contribution to this effort. Next slide, please. So let me share with you a couple highlights from our state plan on aging feedback, just to give you a couple nuggets of information that we think is pretty important and is really going to help to guide our efforts as we move forward. Next slide, please. So one of the things we asked is, if you were not able to access one or more of the needed services that were listed throughout the survey, why not? Why weren't you able to access that information? And we saw a lot of things. The top one was, I was not aware of the service. But we also heard messages or reviewed messages that said, there's no service in my area. I'm on a waiting list. There's no one out there to help me. I do not know where to go, and I am too embarrassed to ask for help. So those are all very concerning areas for us. But they're also areas of opportunity, because we sure can't tackle this issue unless we know what some of the barriers are. So this information from almost 3,000 older adults through a survey and almost 600 people through listening sessions is really critical information to guide our efforts. And we sure know that accessing information for whatever, you struggle in accessing information for all kinds of reasons. So we want to be able to address that. This is great information, and I cannot thank the aging community from the greater Derry Derry area enough for your contribution to this work. Every voice makes a difference in our state. It's one of the benefits of living in a small state. Next slide, please. How do you get information about community services? Check all that apply. Well, again, this is very good information for us, and you can see that our aging community receives information in a lot of different ways. Primarily what we're hearing is family and friends. So again, it's the power of each of us to help others in our community and to bring change for others. The power that each of us has to bring change in our communities. Next slide, please. Are you aware of ServiceLink? So ServiceLink is a program of the New Hampshire Department of Health and Human Services. ServiceLink is New Hampshire's resource and disability center. They're a resource center for the aging community and individuals with disabilities. A lot of our programs come under ServiceLink. We have 13 ServiceLink offices across the state. We have Connie Young with us today, heads up the ServiceLink in this area, a superstar for older adults in this community. I'm honored to work with you, Connie. The work you do, the contributions you bring to this community are tremendous. A lot of the programs that come under the Department of Health and Human Services are run through the ServiceLink offices. We also have Tom O'Connor with us today. Tom is the administrator over all of the ServiceLinks. We had a public comment session yesterday in North Conway where we had about 40 people, and Tom was there as well. And ServiceLink, again, was recognized as a trusted and valuable player across our state. When you read the State Plan on Aging, and I sure hope you read it, you're going to see ServiceLink referenced in a number of places because they're a key partner for us in helping to get information out there and to helping to serve and support older adults and adults with disabilities in the state. So what this tells us is, well, the good news is we've got about half of the individuals who completed the survey are really familiar with ServiceLink. That's great news. But this data also gives us our marching orders. And our marching orders are, we need to do a better job telling people about ServiceLink and the resources that are available at ServiceLink. Half of our crowd is familiar with ServiceLink, the other half is not. Again, this is great data, and it gives us a path, and we are on that path. Next slide, please. What community activities do you participate in? Again, looking at access. We have limited resources in our state. We don't have enough funds to serve the people in the state in the way we need to. So we've got to do a much better job in simplifying access and letting folks know where they can go. Because again, we don't have the resources we need. And those are challenges across our state, right? We hear a lot about workforce challenges. We hear a lot about accessing services. This is not new information, but we sure have some significant direction from this information. So this tells us that a huge percentage of older adults in this state are going to the library. So you can bet in the State Plan on Aging that you have in front of you, we're talking about the libraries. We want to partner with the libraries. In our state, we have a group called the New Hampshire State Library, and they actually will send out information to libraries, hundreds of libraries across the state. So those are partnerships that are invaluable to us in terms of reaching more individuals. So we also know the power of churches, the value of churches. And oftentimes someone will say, well, church and state, they don't get along, right? Throw that out the door. We want to serve older adults in our community, all hands on deck. Churches are a critical partner and player in serving our communities. We need to strengthen our partnership with those groups. We need to strengthen our partnership with the YMCAs, with the town clerks, with community organizations. Next slide, please. Besides yourself, who else lives in your household? Check off all that apply. So out of almost 3,000 individuals who completed this survey, 905 individuals are telling us they live alone. So we know through an awful lot of data from across the country that many people who live alone are at greater risk for health issues, greater challenges in accessing transportation, financial issues, companionship, support. So we need to start paying attention to that sector of our population. Now, the folks that analyzed this survey are called Southern New Hampshire Planning Commission. Just great partners for our work. And they actually took this slide to the next level. And they analyzed and did a data dig on the 905 individuals. And they learned that a great percentage, a significant percentage of the 905 are over 75 years of age. So again, we know as individuals become older adults, the chances of them living alone increase. So again, do we not in our state have not just an opportunity to support these individuals, but perhaps a responsibility to take care of older adults in this state, because they sure have brought significant contributions of leadership, workforce, talent to our state. So what the State Plan on Aging is going to tell you is by the year 2030, over a third of New Hampshire residents will be over 60 years of age. So once again, all hands on deck. How do we elevate the attention towards older adults and the aging community in our state? Next slide, please. What would make healthy aging in New Hampshire better or easier for you? So what I want to note in this question is it's an open-ended question. And oftentimes, we all get a bunch of surveys, right? How many surveys do you get that cross your desk or come in the mail every month? A lot of them. Which ones do you complete? So this was a 29-question survey, and we took a chance when we included some open-ended questions, because some of our committee members felt that that respondents might skip over those open-ended questions because it's already a lengthy survey. But yet, over 2,100 individuals completed an open-ended question about what would make aging easier for you in the state. Number one answer, right? No surprise to New Hampshire. Number one answer is transportation. We have over a decade and a lot longer, we've been hearing transportation. We have significant data from a lot of sources, not just the State Plan on Aging survey. Transportation continues to rise to the top. Housing is the next one on the list. A huge issue for older adults in our community. So something that's happening in the state right now that's pretty significant is there's a piece of legislation called House Bill 621. And it's a piece of legislation that will transform the New Hampshire Legislative State Committee on Aging into a new group called the Commission on Aging. That's important for a couple of reasons. One is the current State Committee on Aging that's been doing tremendous work for our state for 30 years. This is their 30th anniversary. They advise the DHHS commissioner. This new commission, if it moves forward, will come under the governor's office. And it will include not just state leadership from the Department of Health and Human Services, but it will include state leadership from other state entities as well, including the New Hampshire Department of Transportation. So as we look to elevate the attention for older adults in this state, we have an opportunity to elevate the leadership and the individuals who are working on these issues for us and with us. Commission on Aging, House Bill 621. So taxes came up. That's an issue that, again, should be no surprise, especially property taxes in our state. The fourth issue that came up was medical care, struggling with medical coverage, medical insurance. And the fifth was in-home care, assisted living, need for available and affordable services for those who wish to stay in their home as they age. So we sure know from a lot of state and national data that by far older adults want to age in their home and in their community. That's an important goal for all of us as we move forward. Next slide, please. So I talked a little bit about this, but I have to bring it up again. When you are trying to build a plan that includes local feedback, feedback from the aging community across the state, when it includes state partners, when it includes federal oversight and federal requirements, those are a lot of partners. And everybody, if you talk to 50 people about what the needs are in our state, you're going to get 50 different answers. So how do we create one state plan that helps to guide our efforts? what you have in front of you is a plan that a lot of work went into. Is it perfect? No, it is not perfect. Is it done? No, it's not done. We have 29 more days of a 10-month planning process. Please review the state plan. Send feedback. Send it in the mail. Send it electronically. But send it. We need your feedback. The older adult community has been with us for the last 10 months on this planning effort. The next 29 days are critical. Next slide, please. So our goals, we have 4 overarching goals in the next 4 years as we move forward. Number 1, support older people to stay active and healthy. Number 2, promote person-centered thinking and practices. Number 3, ensure the rights, safety, independence, and dignity of older people and prevent their abuse, neglect, and exploitation. And number 4, advance age-friendly communities. Below that, you see the focus areas from our federal partners. And you can bet as a federal partner, we have an awful lot of rules, guidance, steps we need to take to receive approval from our federal partners to receive over $20 million in funds to serve and support our aging population every year. And we want to work to make sure the federal goals overlap our state goals and are aligned with our local and a community feedback. Not an easy task, but a really exciting task and an amazing opportunity. As we heard in the North Conway session yesterday, one voice is much more powerful. If we can all agree, or if we can sort of kind of agree, we will be more powerful in making change. Next slide, please. So we've identified 8 outcomes as we move forward. We want older people and their families to be able to, that are looking for services, to be able to access those services. We talked quite a bit about that already. We want older people, caregivers, and families to be able to access person-centered care and planning, regardless of where they enter the system. So what does person-centered care mean? It means that you're the driver of this bus. It means that this is your health care. It means that we want to ensure that your preferences are included, whatever stage you are in your life. So again, we want to make sure we listen. We listen to older adults and adults with disabilities as all of us age. We want to make sure that folks are informed and have the supports they need. And we want to reduce abuse, neglect, exploitation. And we want folks, our older adults, to live in safety and dignity. So we sure know that financial exploitation is on the rise in our state and across the country. And so we're addressing that in our state plan as well. Next slide, please. We want to also address the risk of loneliness and isolation. So that's something new as an outcome. But it's something that I'm real excited about. I'm real excited that it made our top 8 on our outcomes, because I think it's absolutely critical and it needs to be on the radar for all of us. So we want to look at, we want to make sure people are informed regarding Medicare, and we have our Medicare specialists that are housed out of the ServiceLink offices. We want to make sure that we address emergency preparedness. And we actually have some leadership here today from the emergency preparedness team from the Derry community. So we're honored to share that partnership. And we also want to make sure that we're including diverse populations. For example, we had 15 listening sessions, and 2 of those listening sessions focused on the LGBTQ community. For example, we partnered with the Office of Health Equity in translating our survey into 10 different languages. 10 different languages for little old New Hampshire. And some folks said, geez, 10 languages. Isn't that over the top? Yeah, it's over the top. Let's be over the top in New Hampshire. Let's do everything we can to be inclusive. Next slide, please. So we have 4 public comment sessions happening. Again, yesterday we were in North Conway. We had about 40 people at the Gibson Senior Center. Tomorrow we're going to have 2 sessions at the New Hampshire Department of Health and Human Services in Concord. Next slide, please. So today's public comment session provides an opportunity to provide feedback to the Bureau of Elderly and Adult Services at the Department of Health and Human Services regarding the State Plan on Aging. Next slide, please. So these are some guidelines. I shared with you already that is posted on the website of the Bureau of Elderly and Adult Services. We're accepting comments through May 29th. So today's May 1st, 29 days and counting to provide feedback. And we're really going to keep a very open and formal session, and if folks want to share, we're going to ask people just to share any comments you might have. And I don't believe anybody signed up to actually speak, but that's okay. Everyone's invited to share a comment as we move forward. What I'm going to do is I'm going to repeat the comment per our guidance from our cable folks. They've asked me to repeat the comment if people have any comments to share, if I can. Next slide, please. And this simply provides an email. So I'd invite you to write down that email, and you can share comments via that email, or you can mail comments directly to the Bureau of Elderly and Adult Services. So the address is there if you want to mail it, and the email is there if you want to email it. And you can sure share your comments today. If you'd rather not, when you leave here, if you want to be done, share your comments today. So we sure have a lot of options. I'm just going to leave that up for a couple more seconds in case people are taking that information down. Next slide, please. All right, so this opens up our opportunity for public comment. And I know we have our trustee, Ken Berlin, who is the chair of the Legislative Committee on Aging, who is going to be bopping around with the microphone. And again, we welcome anything. Any comments you have to say, good, bad, ugly, we want to hear them. Yes, ma'am.
Is it on? Okay. I'm Colleen. I'm a social worker, technically with Harvard Pilgrim Healthcare, but I work with the Dartmouth Hitchcock system. And where Harvard Pilgrim has a Medicare policy, we have a lot of older adults now looking for resources. So what I'm finding is a lot of our members are in the gray area of they make too much money but not enough money to get certain assistance within the state. This has resulted in difficulty getting food stamps, qualifying for CFI, et cetera, et cetera. So that's just something that I've run into where a lot of these people are going without food, without assistance paying their medical bills, their utility bills, can't pay a copay for a therapist, can't pay for transportation. So that is just a comment that I have, is that I'm dealing with a lot of that and running out of options for these people and finding it very difficult to make an impact on them, and thus they're utilizing the medical system a lot more for these needs. So that's just a comment that I have.
Great, so I sure appreciate that. And we heard very similar comments in our listening sessions. Some of those folks who might be middle income and how as a result of that, they struggle. So thank you. It's a great feedback. Yes, Martha.
So I was thinking in response to her, after I lost my job, because they were moving to New York, I went down to the unemployment office, and they turned around and they says, well, give me your finances and all that. And they do take you if you're, kind of low income. I was like $5 over on my income. Otherwise, I would have had a job in doing strip ends. So that's one thing. But another thing is that I turn around and I want to work. And I know people my age are still doing part-time jobs and everything. But there was an ad in the Beacon again in regards to helping people that go in. Can you spend at least 10 hours a day with them? And I've got an interview next week, and I'll get a stipend. And you go in, and I'm old, so I don't know if she's going to accept me or not, to go in and see these people and just spend some time to do some errands for them or run and get things for them. I guess you make you know, we need to be wanted and needed. You know, and I don't know. And then another thing is integrated between high school kids and the old people, because I call myself an old kid. So what happens is that 2 weeks ago I went to a Methuen, and they had it integrated. They had high school kids and the older kids, and we were started to do line dancing. They came right in and started dancing. We can be teachers to the young people. Some of my friends says, oh, they make me feel old. I says, how can they make you feel old? Think of when you were young and doing those things. And Timberlane has been doing this for over 5 years, which is Plastow, Atkinson, and Sandown, and they are having what they call a prom. Now that scares people because it was the same thing integrated, but what happened is that I said they should call it a social, because some of the older people said, you know, during a prom, do I have to dress up in a gown? No, come as you are and dance. And they got one coming up in 2 weeks. And then I went to another one in Tewksbury. I went there Monday, and they had young people and old people there. I think we can teach. We can't come out and say to the young people, we're teaching. No, they pick up. Goes in their head, you know? Because when you say, I'm going to teach you something, you know, that's like too much telling you what to do when you're 10. You know, when you're 10 and 20, you know everything, right? So, and then I was just thinking what you said on the screen there of networking between people, between different things. I'm sorry. I think I talk loud, so that's why. Sorry, nobody heard me.
No.
But I don't want to take all your time.
So this is Martha. It's her birthday today. She turns 84. She attended the Rockingham County Nursing Home Listening Session in the winter. Yeah. She attended the older adult listening session at the Marion Darish Community Center. And just your comments are spot on. And I want to comment on a couple of things. So you talked about how, you might call it a social, right? So the words we use are so important in engaging
Definitely.
People.
Yeah.
And we're sure learning about the importance of words through reframing aging. So the New Hampshire Alliance for Healthy Aging in our state does amazing work. They have about 400 individuals on their listserv. And one of the things we've learned from them are the importance of the words we use. And through their guidance, you're not going to see the word senior services or elderly services on our estate plan, maybe once or twice, if that's the name of the organization. You're going to read terms like older adults, older people, older individuals, because we've learned, just as Martha is sharing with us, the power of the words we use in engaging people. And the senior centers of our state, we have 65 senior centers in our state. We also have something called the New Hampshire Association of Senior Centers. 25 of our senior centers are members of the New Hampshire Association of Senior Centers, but also a lot of their members are community centers. Because as we know, a lot of our community centers also host congregate meals. And one of the things the Senior Center Association is looking at is, do we look at what are senior centers called? For example, in Concord, I live in Concord, and on the way home I drive by the Good Life Activities and Programs. It's a senior center. It's called Good Life Activities and Programs. So do more people go because they don't use the word senior? I'm not sure. But these are important things that we need to consider. The words we use can either engage people or alienate people. And right now, we're on a 4-year state plan path where we want to engage people.
Well, about 10 years ago, I read in the newspaper, New Hampshire wants to promote you to stay in your own house. And that's what I keep saying, to promote that idea. And thank God for libraries. Thank God for libraries, because they do as much as they can, you know. But that's all.
Martha, you're an ambassador. You're an ambassador for the
Yes,
aging community.
I hope I can take as many of these and bring them to all my friends in the next week or so. We've got 29 days, right?
If you could just find 50 more people just like yourself, and we will.
I keep trying.
All right. Thank you. Thank you very much, Martha. Other comments or questions? And you can, yes, Representative. Thank you.
Oh, you're a gem. You really are. You're great at this, and I'm so proud to be associated with you. No, it's amazing. I think the concerns in Derry is for the seniors is transportation. You know, we have CART, but CART doesn't work at night, and you have to make a week's presentation to them, you know, in order to use their services. So I think transportation is one of the main issues in our town. Another one is affordable housing. There's plenty of housing. We have the largest housing unit in the state of New Hampshire, the Fairways, 1,000 units there. But what do we have for the seniors that make it affordable for them to be able to live comfortably in a nice place? The transportation, the housing, and I think medical is another issue. It has to be affordable. Medical is very expensive. It's expensive to go to the doctors. It's expensive when he gives you a piece of paper and you've got to go to the drugstore and get medications. I think these are all the concerns about the elderly that have to be addressed. Housing, transportation, medical, and we could go on, but you're amazing, and thank you for coming to Derry.
Thank you, Representative. And what you'll hear from the state, from our state rep from your area, is the concerns she's seen in the Derry community mirror and align with our statewide concerns. And I'm guessing our concerns mirror with other states as well. Yes, ma'am. Thank you.
My name is Jill, and I work for the New Hampshire REAP program, which is working with elders. And I've actually had clients that are unable to afford their medications that run $400 a month. So just to piggyback on Phyllis, what she was saying, I'm in total agreement. We need transportation, we need affordable housing, and then people should not have to go without their medications because they can't afford it. That's just ridiculous.
Can I ask you to give us a 30-second message on what is REAP? So REAP is in our state plan. It's a valuable service. And because one of our goals is in the state plan is to do a better job educating folks and letting them know about the resources, we need to start that today. So can you just tell us, what is REAP?
REAP stands for Resource Education Assistance and Prevention Program, and it's for people over the age of 60. It's the best program ever. We go out into the homes, or we can meet the person wherever they want. So transportation's not an issue for people because I can go into their home and meet with them. We act as a support to someone, whether they, it may be someone suffering from depression because they've lost their spouse, or they live alone and their pet just died. We go in and we can support them in that way. I've been working with some people that have tendencies of a little bit of hoarding, and so we're working on getting their homes cleaned out, providing resources for doctors, just whatever their need might be. We're there to help them get through that, help them with paperwork, sorting out their bills, or working on a budget. Whatever the person's needs might be, it's a very flexible program, and I think it benefits a lot of people.
Wonderful. Wonderful. Thank you. And thank you for your work on behalf of our aging community. Yes, ma'am. Did you have a comment? Thank you.
Thank you. So my name's Nicole. I'm here in Derry, grown up here. My family's here. I work here. I work for the Parks and Recreation Department here, where we work with a lot of adults of all ages. And this group that we talk about generally is what we call 50 years old or better. That's what we've kind of coined it for probably like the last 13 years that I've been working there, if not longer. So what we like to talk about a lot recently is dementia friendly. And so I only mention it, not that I definitely saw it in here, but there seems to be a disconnect for families. They have the opportunity to talk to their loved one, encourage them to go to a doctor. They go see a doctor. There's a resource person there. You get to the resource person, and they say, well, they shouldn't be living at home, so maybe call these services. And then you call that service, and then you call this service, and it takes a long time to figure out, okay, not only does my family member maybe have Alzheimer's or dementia or a chronic illness that's going to be a challenge for us moving forward as a family, but how do we get them the resources that they need? And there is really, most cases are case by case, but at the same time, dementia and Alzheimer's and what to do next should kind of have a good template. And a lot of these medical offices, even down in this area, don't have that. And I only can say that from my own personal family experiences, as well as multiple people who've come into our office asking, what do I do next? How do I find housing? How do I help my family member get transportation when I live in, Utah? How am I helping them? So again, saw that a bit in the plan of contact, but we do mention going to Service Link. Transportation's tough to get to Service Link if you're in Derry. You can't get to Atkinson. CART does not bring you there, I do not believe, unless I'm misspeaking there. Yes, correct. Thank you, Connie. So we have CART here in Derry, which is great, but if you need to get to Atkinson and you can't get there, you're hoping you can get a good phone call and a good conversation, which is, again, we always refer people out, but it just seems that there's sometimes that disconnect between services and availability for transportation, medical, doctors, and family. And so my statement is wraparound service. How do we create a wraparound service culture in our state moving forward to help all people of all ages? That's all.
Thank you, Nicole. Thank you so much. So I just want to share that we sure heard the concerns around Alzheimer's and dementia, and they need to do a better job educating our healthcare professionals around those issues. So you're right, we did put that into the state plan. We did also have many staff members and volunteers from the Alzheimer's Association of New Hampshire and Massachusetts participate in the listening sessions. So they were actively involved. They heard these messages loud and clear, and they're wonderful partners. So we sure appreciate that message from you. Thank you. Other comments? Connie.
Thank you. I'm Connie Young. I'm Program Director at Rockingham Service Link, and I'd like to piggyback on Nicole's comments, which were excellent. Actually, all the comments really helpful. So I keep looking at the one slide that says not aware of service accessibility, which that's a high number. And my comment would be that we have a start to a solution in our service links, and I think looking at the wraparound concept is spot on. How do we develop that? In terms of people not being able to get to us, we can often get to them at a more local level, so if I'm in Atkinson and they can't get there, whether it's via the telephone, whether we come to Derry and meet in a community location, or for the person that can't leave their home, we go to the home. So hopefully we can either break down any existing barriers there are in regards to that, or clarify there isn't a barrier. I guess my other comment is really a question. So what will be next? The 29 days, they happen, and all the comments are in. You complete the plan, right? Submit it to the federal government, and then they say yes, no, whatever they say. When does it come back to New Hampshire? And on one of the slides I could see, it was a series of all the different entities and groups involved, and the public was, I think, at the bottom there. But how at the local level, when that plan comes back to New Hampshire approved, how can we start to implement it and make it alive for 4 years?
Super. So Connie Young, who's the Program Director of Service Link, is asking us about next steps. What happens after today? What happens as we move forward? So I will share with you that on May 14th of this month, we have one of our most important planning meetings of the State Plan on Aging Planning Committee. So we're going to sit down with over 30 leaders from the community organizations, including older adults who are represented on the State Committee on Aging. And we're going to start looking at that feedback. So we're going to see what kind of feedback we get in 2 weeks. We're going to come together as a team. Then BEAS, the Bureau of Elderly and Adult Services at the Department of Health and Human Services, will have a meeting shortly following that. Then what we're going to do is, our goal is to wrap this up by about June 1. Then we submit it to the chair of the State Committee on Aging and the Commissioner of Health and Human Services, and we ask for approval and signatures. We make any additional changes. We submit it to our federal partners, the Administration for Community Living, on July 1. So they give us a yes, because they're going to give us a yes, right? Because we're doing an awesome job together as partners. So we get the yes. Then on October 1, the plan starts. So what does that mean? One of the first things within that plan, and if you read the whole thing, or at least you read the 35 pages in front of you, which is the narrative, you're going to see that within our plan, and we want to do this fall, this winter, as soon as we get the yes. We want to do another road show, if you will, and bring the plan out into the communities. So last winter, we did 15 listening sessions. And I know in talking to Ken, the chair of the Legislative State Committee on Aging, he and I want to do that again. And I know Wendy, who's the Bureau Chief of Elderly and Adult Services, is very supportive of that. So I also want to share that Wendy is not here today. She heads up the Bureau of Elderly and Adult Services, but she is extremely involved in this plan. She and I communicate many times every day. So she knows every piece of this plan. She is in strong support. She's a leader for our state and helping us to move this forward. So what we want to do is our goal is to bring this plan out into the communities in October and November and December. Reschedule a few of them because we're going to get hit with a few snowstorms. But we're hitting this in the winter because we want to do it right after that plan gets approved. And we're going to share highlights of the plan, and we're going to do just what you're suggesting, Connie. We're going to say, how can we work together, and how does this impact you? We believe so strongly in community input that we have it in the plan to bring the plan out into the community at the end of this calendar year. So, Ken, I know you've got a comment as well. Thank you.
Hi, I just wanted to say one thing. I've learned a lot over these listening sessions, and not only are we going to plan to go this year to roll it out, but as part of either SCOA or the new commission, we want to do it annually, because I've heard from too many people, you need to come out here more. We don't see enough of you. And I think we have to hold accountable the people that are implementing this or not, that are trying to do this as best we can to be sure that it's reaching the communities we're trying to hit. So my goal is to have us come out annually, like I said, and then have the same type meeting and see where we're going, so that in the year, 2023? Oh my God. That we will have made substantial progress, but not only that, everybody will feel that they know what exactly we have done and where we need to work and what we can improve and things like that. So that's all.
Thank you so much, Ken. Connie, because I know our partners and friends at Community Cable are videotaping this, and they are going to air this information throughout our communities, I'm going to ask you, because the role of ServiceLink is critical in terms of the services they provide and deliver, can you give us a 1-minute message? One of our goals is to do a better job of educating people on the work and on the Older Americans Act core programs. And ServiceLink implements and oversees many of those. So Ken, can you just can you share your mic with Connie? And I know I'm putting you on the spot, Connie, but I know you can handle it.
That's fine. So in each county in New Hampshire, there is a ServiceLink. It's your local place to turn to as you're aging. And I sidebar, I love that we're saying aging and not in the plan. So when you're aging, caring for someone who is aging or has disabilities and they have needs, where do you turn to? You turn to your local ServiceLink office. And within our offices, you're going to find trained, competent staff who can listen to what you need. It's not hard. You tell your story. You let us know where you're at and what is causing challenges in your life and what's working in your life. And then we help you understand what the options are to address your needs. Maybe your needs transportation. We're going to identify the transportation resources. We're going to explain to you, here's how you access it, and we're going to offer help accessing if that's what you need. Perhaps maybe you're caring for your, and it's not unusual now, your 100-year-old dad. And Dad's having a few challenges, but he wants to stay home. We're going to identify, here's what's available, here's how it gets paid for, here are the options. And then again, we're going to help you access whatever it is. It's not complicated. It's come talk to us, tell us your story, tell us what you need, and we're going to help you walk forward. Some of the key components to what we do: Medicare counseling, health insurance. We are called the New Hampshire SHIP, SHIP, State Health Insurance Program. We are trained and certified to be able to provide Medicare counseling. That means you're getting ready to turn 65, you're going to go on Medicare, or you're getting letters saying you're going on Medicare. You don't have a clue what to do. Common. We can educate you about your options. You're that 100-year-old dad, and you got a bill, and you said, that bill makes no sense to me. What's that all about? I don't think that's correct. We can help you, understand if it's correct, if it's not correct, and maybe there was something fraudulent, and we'll help you report that fraud to the federal government, where many millions of dollars nationwide have been recouped because of fraudulent activities. Maybe you're at the point where, you say, okay, I need to think about nursing home placement for my loved one, and you don't know how to pay for it, you don't know where to start. It's undoubtedly an emotional time in your life. We're there to help you walk through maybe what is the long-term care Medicaid program, explain it, how it works, what you need to do to prepare, the steps you'll go through. Maybe you're a veteran. We work heartily with New Hampshire veterans. Right from hello, we are trained. We to know to ask our callers, have you or a family member ever served in the military? Because once we do that, it opens a whole new world of opportunity in terms of resources. It helps us understand a little bit about this person, So we work with our veterans to connect them to the resources available because of their service and their family members. Then we have our New Hampshire Family Caregiver Program, which day by day in Rockingham County, I can say for certain, we are identifying more and more people caring for a loved one in their home. They're informal, unpaid caregivers. They're caring for a loved one. Often it's an 85-year-old caring for an 87-year-old, living independently. They're just doing it, but the caregiver needs some support to be able to maintain their physical, their mental, stability, and to continue taking care of their loved one. We work with them to understand the need for their own self-care, and then there is a respite grant that is available to help support them financially. If they respite equals relief. You need a little relief from your responsibility. We can help with that. There's so many more things that go on at ServiceLink that I never know what question might be on the other end of the phone. Don't worry, just call. The toll-free number is 1-866-634-9412. There is one in each county. In Rockingham, we're fortunate. We have one right in Atkinson and another one in Stratham. You can call, come, email.
Can you share the phone number one more time, Connie, please?
1-866-634-9412. It's a great resource, and it has the potential to make services more accessible.
Thank you, Connie, so much, and thank you so much for ServiceLink. Other comments or questions? Representative Katsikaris, please.
Thank you. Connie, great presentation. Another town jewel. I just wanted to share with you what the town of Derry is doing. Our chief of police, Ed Garone, had realized that seniors didn't like to call the police department. They felt that they're too busy down there, that, you know, their concerns or their upsets were not important. So the chief had realized that there should be some kind of a committee in town. So he formed the Senior Advisory Committee. There's 8 or 10 of us on the committee. He started probably 12 years ago. And we are the in-between people between the seniors and the police department. It's our hope that the seniors will call us and say, look, I got a problem. It could be a neighbor, it could be an animal, it could be somebody that's bothering them, it could be that they're afraid, that call us. We would relay that information to the police department and then take action. But this is a program that's been in town for a good 12 years, and it's under the direction of Chief Ed Garone from the Derry Police Department, and it's great. It's a great thing. Thank you.
Well, hats off to the Derry Chief of Police, and if he could just bring that plan to, 100 other towns, that would be wonderful. That's great. That's great news. Other comments? Anything else that anybody wants to share? Yes, ma'am.
Okay, one word.
One word, maybe a few more, but I'll date myself. Back in college, I think I had to read as one of my projects for my internship, the Older Americans Act. So the very first, and that was probably around 1970. But my professional career has taken me around a lot of the senior kind of networks, Meals on Wheels for 10 years, hospital. Now I'm on the Service Link board. I was on a state committee on aging a number of years ago. But the biggest part of the Older Americans Act and why it began was to prevent that isolation and to let people feel that they are needed, they are welcome, and they are an important part of the society.
That's a great little historical tidbit. Thank you. A treasure. Other comments? All right, we are going to conclude early unless there's any other comments. All right.
I would really like to thank you for coming out. Thank you for the job that you've done. I mean, and really just as you move forward, like I'm envisioning town halls, town hall meetings for our older adults to keep this thing alive. And I hope that we'll all sign on to help make that happen. I really do.
So great message. How do we keep this alive, right? So it's not just another state plan that goes on your bookshelf. How do we keep this alive and breathing and growing every day for the next 4 years until we have the next one? So on behalf of the New Hampshire Department of Health and Human Services, I sure want to thank all of you for coming today. Representative Katsoukaris, you're just such you're a gem in this city and in this state. Do you want to share closing comments with us, ma'am?
Thank you. I just wanted to thank you so much for coming. I mean, you're a wealth of knowledge between you and Connie. I mean, we've learned so much, and I hope that the people in town, tune in, which they do, because channel TV camera is everywhere. And this was great. This was wonderful. We don't have the crowd that we had hoped, but that doesn't matter. People are interested and they want to help. And I thank you so much for coming to Derry, and you too, Connie, and keep up the good work. And we're proud to say you're part of New Hampshire. Thank you very much.
Thank you so much. Safe travels, everybody, and feel free to grab a water or a beverage on your way out. And we'll also be sticking around if people want to have any one-on-one conversations. Again, thank you so much.